Are you okay if I record it right away?
Yeah, you can, sure.
Okay, go ahead. Go ahead.
Yeah, so my name is Dr. Sunkuru Toure. I'm a lung specialist and critical care physician in Texas. I'm originally from Katong by way of Brikama, Nyambai, and Ghana, and Massachusetts, and now Texas. I'm also the co-founder of the Permanent Health Lung Institute, and I'm excited to talk to you all today about what we're doing as a company.
Welcome, Sunkar.
Okay, so I think I don't know who is on the phone. I see Papa S and someone else on the phone there. Do you know who that is?
The iPhone, I am not sure.
That's fine. Okay, so I'm gonna go ahead and is it okay if I go ahead and just do a quick presentation on
Yeah,
what?
yeah, go for it. Let me see
Okay,
if I can
I'm gonna
give
share
you
my screen.
access.
Can you enable me with screen sharing real quick? Mustafa, I don't.
Yep, go ahead. Try it
Okay,
now.
good. See here. Can you see my screen?
Yep. Yeah.
Okay. Okay, so like I said, this is my name, and we founded Permian 2 years ago, actually, after years of working here and going to Gambia to try to see how best we can help out with the healthcare sector in Gambia. So, we started an air quality monitoring network as our first strategic initiative, and I'm just going to talk about the network real quick because Mustafa and I talked about it. Um, and this is just a little bit of blurb about Permian. I'll skip that. And that's me. My wife is a co-founder as well. She's also a physician. We're both Gambian. She's from Badibu. Um, so we believe that every Gambian has a right to have healthy lungs. And, we want to be able to do that by using an evidence-based approach, tapping into the experiences we've had in the last few years in the United States and also from our work in Gambia. And we believe that we should do that because most Gambians are exposed to poor air quality without even knowing it. And we have a lot of people that don't have the means to have their lung problems assessed. And that's not a Gambian problem alone. This is actually a report that came out from UNICEF last year with a very apt title called Silent Suffocation in Africa. We have very poor air quality there. And to me, I discovered this when I went to Gambia and started seeing young women and young adults who have never smoked in their life and they have bad lungs that I've seen in patients here who work in coal mines or have had decades of smoking. And I started asking myself questions about what's driving this. And apparently, air pollution is a big problem in Gambia. We're going to be using like implementation science, community engagement, and clinical care to address this issue. And we have two strategic initiatives. So the first one's called the Clean Air Initiative, and the other one is called the Women's Lung Health Initiative. I'm going to talk about the Clean Air Initiative today because that's what's most relevant to what we're going to be doing. Um, and just some background here. So this is data on air quality. Red is bad air quality, and green is good air quality. And you can see that most of Africa, Southeast Asia, and parts of Eastern Europe have the worst air quality in the world. Unfortunately, that's where we have also a lot of people who may not have the access to care. This is data from Africa on indoor air pollution being on the decrease because we're using healthier stoves. I'm sorry, I can go back here. Whereas outdoor air pollution is actually getting worse. And this is being driven by our population and urbanization rate. Brikama, Mustafa and I grew up there. Nyambai was like a backwater place next to the forest. Now people have houses in the forest. It's kind of scary when you think about it. And our urbanization rate in Gambia is about 67% in most recent data that was there. So again, there's lack of air quality data in Africa. This is the world map from UNICEF that showed each green dot is an air quality sensor. So you can see the United States is completely covered with sensors. Europe, Southeast Asia, India, urban areas of Australia. Central Australia is all desert, so you don't see much there. This is all Siberia, so you don't have much sensors there. But look at Africa, densely populated area, over 1 billion people, and just a handful of sensors. Okay, so again, only 7 countries have reliable real-time air sensors in Africa, and only 6% of children in Africa live near an air quality sensor in Africa. So that's a big problem there. This is a video. A picture is worth 1,000 words, right? So again, each green dot on this video is an air sensor. This includes some of the sensors that we have since installed in Gambia. So you'll find that you can see some work being done there. But really, when you zoom into Africa, you'll find that for an area that has a lot of people, we don't have that many sensors. Look at Nigeria, over 200 million people, and only 3 or 4 sensors in that country. You look at parts of Ghana, over 22 million people, very few sensors. East Africa are actually the pioneers, and Southern Africa. Uganda has a fantastic program that they've been running, and they've actually started manufacturing sensors in Uganda. Ethiopia has only 1 sensor that's published out there, and as you go down to parts of Southern Africa, this is South Africa, obviously highly developed country, and they have more sensors in those areas. Now, in Gambia, before we started our sensor network, look at Gambia now. Gambia has one of the highest, Gambia has one of the highest sensor networks in Africa. And that's because of the work that we're doing in the country. We, since the beginning of this year, have been installing sensors in different locations: Brikama, Tanje, Kanifing, Brusubi, Sanyang, and we have about 8 more sensors that we have in the country right now that we're going to be deploying going forward. So our goal is to have a sensor in every region of the country. We want to be the first country in Africa to achieve this. Look at Dakar, only 1 sensor. This is from today's map, by the way. So again, Africa is underrepresented in the climate and air pollution monitoring space, and that puts us at a disadvantage. There's no legislation in Africa for air quality. Most countries do not have any legislation for standards. Only 19 countries have any kind of air quality standards. Gambia doesn't have one. Most countries in Africa use household energy sources that are not good for your health. Only 6 countries in Africa have regulations for waste management. So people burn their waste indiscriminately without any regulations in Gambia. And it's the case in most places in Africa. Very few countries have any vehicle emission standards, and there are very few production incentives for businesses to incorporate clean initiatives in the country. And this is from this recent report from the United Nations Environment Program. Again, most countries don't have any regulations for burning waste, and that's a very big source of outdoor air pollution in Africa. And also, most households don't have clean stoves. Only 3% of Gambian households have access to clean stoves. So again, a huge area for potential improvement. Again, the legislative area is also lacking as far as that is concerned. And for Gambia right now, we don't have any air quality standards. The government doesn't have any public air quality monitoring network. There's no legislation in the country that says, here's how we should go about doing that. But the World Health Organization actually recommends that countries should try to establish what their current levels of pollution are, and then set interim targets with the goal of achieving the recommended air quality guideline targets. And that is where Permian Health is really driving this innovation. We are establishing the largest air quality monitoring network in the country to provide data, not just for us as a company that's interested in lung health, but for the government and for other interested governmental agencies to begin to raise awareness about air pollution. And as we continue to urbanize, we can begin to think about building smarter cities that incorporate these types of technology so that people in those areas can have adequate access to good air. So we're calling it the Clean Air Initiative. It's a multidisciplinary effort. We want to collaborate with all kinds of agencies, businesses, government agencies, UN, hospitals, private individuals, and also nonprofit organizations. We are going to be installing one of the most advanced low-cost sensors. This is actually a photograph of what it looks like. It has a solar panel, and that's a sensor on the outside. And it actually samples air every 10 seconds, and it uploads that sensor to a network. This is our page. So you'll find, for example, we have sensors installed in Banjul, the KMC area, West Coast region. We have 5 more sensors there. So you can see the air quality index, for example, in Brikama right now is about 8. So anything less than 50 is good. So it tells us air quality is good. These are photographs of the installed sensors in those areas. And you can see we have only 9 followers who are following the sensors from the website. But I think it gives us more information there. So when you click on a page, for example, in Vesuvi, we know that air quality is good. It gives you health recommendations as well. So you can say you can open your windows, you can go outdoors and play. It's also a weather station. So it gives forecasts for the weather and also a forecast for air quality in the next 7 days. So if you're planning an event or, there's going to be poor air quality in the next few days, you can actually give recommendations about air quality. And this is another, so the data, actually, this is the technology behind it. So the sensors measure air quality, and it uploads it onto a cloud. So we have a 4G SIM card in the sensor that actually uses that data to upload it to the cloud, and we use an AI algorithm that belongs to IQ Air. IQ Air is one of the 2 leading low-cost sensor technology based out of Switzerland, and they're actually the UN Environmental Program partner for low-cost sensor manufacturing. So we partnered with them to have access to the platform, and then get the data outputs that you've seen on the prior slides that is easy to use and accessible both on the website and on an application as well. So you can have you can download the IQ Air app, and Mustafa sent me a video. I forgot to put that on this slide, but we can actually show you how to get the IQ Air app, and you can add, a location in a country to your phone and get alerts on what the weather is in real time. And it's color coded. Green is good, yellow is be cautious, purple is actually the worst air quality that you can have. And case studies like Asia is really leading in this area. This is an international school in Bangkok, and they have installed sensors in their school so that children with asthma who go to school can actually, know what the weather is going to be like. Maybe on a day that the air quality is bad, physical activity can be limited. We do that here in the States when the weather is very hot. My kids out here in the Texas heat, they don't go outside when it's hot. So you can take informed decisions about that at the school level. Certain businesses, this is a real estate developer in Thailand, and they install these sensors on their developments as part of their initiative to build green cities. And, we've reached out to some of the real estate development agencies in Gambia. I think through the conference, we hope to showcase some of the work that we're doing and maybe get them to buy into putting these in their developments. Look at this. These stations are followed by 3 million people. So you have very high levels of engagement because air quality in Southeast Asia is a big problem. There's a high awareness there. So again, you can see on their website, they have all kinds of information there. They're very proactive in terms of what they're doing. And I hope to try to share this with some of our development partners in Gambia to give them an idea of, how to build green cities. And I think for the Brikama Nema Association, some of the things that you're doing really dovetails into this as well, to have the ability to measure air quality and the weather with forecasting options for residents of Brikama. And I'm going to stop right there and see if you have any questions at this point.
Yeah, that's a very good presentation. So like who stores the data? What do they do with the data as well? You are muted, Sunga. You are muted. You're on mute.
So the data is available to us. We have a back-end platform, and we, as part of our initiative, would share the raw data with any interested governmental agency. So if you want the data on air quality for the past year from Brikama, we'll have a form you fill out, and we'll send it to you in either CSL or Excel spreadsheet, and we'll make it available to the government as well, because the government needs this data to set national standards, and they've already come on board through our partnership with the National Environment Agency.
Okay. So you mentioned that you're trying to get it to different regions. Like, is there a difference, like if you have 5, 10, or 6 within one region, or like?
So ideally, the more the better. right?
Okay.
But I think if you have a sensor within like a 50-kilometer radius, and that's why we focused primarily on the Greater Banjul area, because 2/3 of Gambia's population lives in Banjul, West Coast region, and KMC. But at the same time, also, we have to ensure that we spread the sensors in locations that are sparsely populated, just so we can get data in those areas as well. So for now, we'll concentrate on the Greater Banjul area, so-called Greater Banjul area, and then hopefully we can expand it to other rural places. But again, the more the better. You've seen the maps in the States. They have them in every street, intersection.
Yes.
Yeah.
Yeah, because that's what I was thinking. So if you had it, let's say you have one in Manjai and then you have, in Nyambai,
Yeah.
and then you have one in Newtown or one in Nema.
Yep.
I mean, do you expect to see any difference in the air quality?
I think, I think in Brikama, we'll need more than in densely populated areas, you need to have more sensors because, and that's why I think, partnering with you guys would be very helpful. If we can put it in the town center, heavily trafficked areas, and also in parts that are densely settled. So, again, there's no formula for it, but the UNICEF tries to make sure that somebody should live within 10 kilometers or 5 kilometers of a sensor. But again, for us, we're just starting off. So in a place like Brikama, 2 or 3 sensors for a place like Brikama would give you a good idea of what the air quality is in those areas. KMC will definitely need more because it's, they have a lot of people in that area.
Yeah, because the reason I ask is like, maybe this is changing a little bit, but most households use traditional cooking methods like firewood and all that stuff. And you have women trying to turn on this fire just to cook meals and every day. Like, I'm interested to see how that data would look like from residential to public. Like in the market area, there's going to be a lot of foot traffic, but people are not necessarily going to be cooking as much, or maybe unless there's a location where they smoke fish, for example. How is that air quality different from the air quality compared to the air quality in another area that doesn't have that much foot traffic?
Yeah, so it's a good question. So cooking is indoor air pollution. It's considered indoor air pollution.
Okay.
We have invested in wearable air quality sensors that you can wear where is it? I have it here. So this is my camera. This is an Atmo tube wearable sensor. And you can actually wear this as a dongle. It actually measures individual exposure. So we are applying for IRB approval from the ethics committee to give this to women in different areas and different professions when they're doing their cooking, that will measure real time what their individual exposures are. And that's different than outdoor ambient air pollution that you breathe when you leave the house. So the sensors that we're installing right now are going to be measuring outdoor air pollution, but we already have plans in place to do studies to measure individual exposures during different activities like smoking fish, cooking, and also another big one that people are going to hate me for is churai. Churai is an indoor air, that's incense. So they burn incense in the house as an aromatherapy to freshen the aroma of the house. But in a poorly ventilated household, when you burn the churai, you're actually polluting the air in your house. So we're going to get households and we'll measure the air quality when the churai is on and when the churai is off and see if there's a difference in exposure.
So
can I ask a question?
Yes.
Since that is probably a tradition, right?
Right.
How would you go about mitigating that in terms of whether it's behavior, whether it's the patterns, and I mean, how do you kind of implement some of those measures that can mitigate the impacts within the household, that is?
Yeah, I mean, so for me, honestly, there are no building codes in Gambia that stipulate what ventilation should look like in terms of the windows. And I think just drawing people's attention that, okay, if you're building your house, you need to have good cross ventilation. And also maybe if you have a pre-existing condition like asthma, COPD, or high blood pressure, that maybe you might not want to turn the churai on and be in the room while the churai is burning, in the room. It's going to have to be behavioral. Obviously, you want to be careful not to castigate our tradition. But I can bet you, I know for a fact, because I see asthmatic patients, they don't like the churai. And I think it's just counseling people on an individual level to make an informed decision about things. It's like smoking and drinking. I cannot tell people not to, you can only give them advice, and they can really make the decision about what they want to do with that information.
So like the other one, like our residents, they might ask, how does this benefit us? Like, what can we tell them? Like if they ask you a question, okay, you're bringing in air sensors, what's in it for us? Like, how is this helping us?
So I think the benefit is gonna be for society as a whole, because, we don't know. For instance, I'll give an example. I actually have a slide on that on my talk on air quality and health. For example, the Bakote dump site, right? We don't know what the exposures amongst what they call scavengers are. So there are people that go to the dump site to scavenge for recyclable material. We know that when you're exposed to that, you're going to end up with asthma, cancer, high blood pressure, stroke prematurely. Very strong evidence for that. Okay. I've been in touch with the mayor's office. What about registering those scavengers and, making that registration be predicated on some sort of training, and also giving them masks and PPE to ensure that while they're scavenging, they're not exposed to the toxic effects of pollution in the course, because they're doing a good job of recycling waste. So I don't want us to cut them off their source of livelihood. But for us, we've identified those people as a potential vulnerable population whose livelihood puts them at risk of developing, complications. Another population that would have potential benefit would be, for example, households, right? There's an initiative to provide clean stoves to households. I don't know if you've seen it in the news recently. By showing air quality and connecting air quality to hypertension, stroke, diabetes, and asthma, and showing a clean stove as a potential intervention to reduce that effect, that's a public health measure. And that's why, I don't have all the answers, but I think the public health people in Gambia would potentially be able to make those decisions as well. And then also, Gambia is a fish-dependent economy, right? You go to Tanje. I actually have a very interesting photo I want to show you. In Tanje, people that process fish, they do not wear any masks. And those people are going to end up with COPD. Those are the people that I've been seeing over the years. I'll show you the photograph that I'm talking about here, some of the slides. Let me see. Sorry, Mustafa, I apologize. I want to show you this. Okay. Can you see my screen?
Yep.
Okay. This is a photograph by one of Gambia's best upcoming photographers. You can see this woman cooking, and there's firewood next to her. Somebody like this, a public health intervention that provides a clean stove might be more attractive. And this is the churai that I was talking about, where you burn incense in the household. This smoke is not good for your lungs. If you have asthma or COPD, it's just as harmful as smoking. But again, when you look at things like sand mining, for example, these people are actually exposed to silica. Silicosis is a form of air pollution. Can we require our sand mining companies to provide them with PPEs where they can wear N95 masks to protect them? These are young people who are going to end up with lung disease in their 40s and 50s. So again, another population that we've had in Gambia, like air pollution, bushfires. These are all headlines in the past 2 years where there have been bushfires. And the thing about bushfires is that the bushfire can happen in LRR, 50 miles away, but then the air pollution can end up in some place like Canifing. So that if we have sensors in LRR and in Canifing, we can then issue, TV advertisements and say, hey, the air quality is poor. If you're going outside, please wear a mask if you have these following conditions. So again, there's a public health intervention to it. Again, this is the backward dump site. These people are scavenging for trash to recycle. None of these guys are wearing masks. These guys are going to end up with asthma, COPD, lung cancer, and hypertension if they keep working here for decades. Again, it's a very strong thing, and the graph is just crazy. So this is what's scary about Gambia. The most recent survey from the health department indicated that if you take 1,000 15-year-old girls and 1,000 15-year-old boys, 114 of those 1,000 girls will die before the age of 50. 124 of 1,000 boys will die before the age of 50. And they're mostly dying from non-communicable diseases. So again, the highest mortality is in our age group, Mustafa. It's in our 40s. You begin to wonder what is happening when they're younger that makes them develop high blood pressure. You go to Carnifing General Hospital or EFSTH, they're all there with strokes, high blood pressure, diabetes. It's in the air. And I think our diet is also the problem. So I think the sensor for the Ministry of Health will help generate good data for them, but also to allow us to make a case for example, the mayor of KMC or the chairman of Brikama Area Council to seek for funding to think about ways of improving road traffic and also better interventions for their populations as well. So I'm going to stop sharing my screen.
That's awesome. Yeah, and that's interesting. When I hear hypertension, sounds like I used to think it's what we consume. The type of food that we need. I had no idea that it had anything to do with the air quality. So
that's the thing we'll talk about in the conference too. Like there are 5 risk factors for non-communicable diseases, and air pollution is the 5th one. Here it is, right here. These are the 5. Unhealthy diet. Can you see my screen?
Not yet.
Not yet. Oh, hold on one second here.
We have like 6 minutes, but if we get
I'm sorry, I apologize.
You can still click on the link if you want to.
Yeah.
So I want to bring up a question though.
Sorry. Yes.
Right?
Yes.
While I was in Nema, I spent 2 months there. I think there was some heavy winds.
Yes.
I guess they're coming off the Sahara, and in the very dense areas, especially around the Brikama market, the dust and the particle levels were very high. Now, because of the landscape and the streets that are not paved, there's a lot of dust, there's a lot of particles. Are these sensors able to measure the kind of concentration of particles in the air and the kind of seasonal impact that those winds would have, especially during that period, and how in fact those things can be mitigated based on those measures,
Yeah. So to answer your question, yes, the sensors can actually detect that. And we know for a fact that the dry season is the season that has the worst air quality in Ghana because of the dust storms from the Sahara. I think last year, while we were piloting this thing in April, we had very high concentrations of particulate matter. They were like almost 10 times the recommended levels for safety from the World Health Organization. So again, by installing these things there, we'll be able to show the data. And, for town planning, for example, tree planting exercises to mitigate the effects of, like dust pollution. And also at that time, it might be a good time to liaise with our public health people on the radio and talk to people about the need to make sure that you're wearing a mask if you have certain conditions, would be helpful. And also for town planning. So yes, it can detect PM 2.5, and it's actually the sensor we bought, and that's why we went with IQ Air, is the one that's actually used by the World Health Organization and UNICEF for sensing in different parts of the world.
Okay, great.
So yeah, Mustafa, this is just to show you like the air pollution is actually the 5th, one of the risk factors for bad outcomes in patients with non-communicable diseases. So again, this is all data that came out in the last decade. So we're hoping to kind of share this with the general public in the conference, and other folks will talk about that. But what can we do with this information, and how can we collaborate with the putting sensors in Brikama as a way of measuring, air quality and using that information to, formulate evidence-based, development plans going forward.
That's awesome. So last question, like how can we help, like as an organization?
So, like I said, we want to partner with any organization to allow us to install sensors in a location that is safe. It comes at no cost to our partners. We will purchase, maintain, and pay for the cost of the data to keep the sensor as a way of ensuring that we have integrity in the data we compare. You can actually access the user-friendly format online or through the application for free. And if you want the data from your sensor, you can we'll give it to you for free. So there's no cost to you. We're trying to democratize access to air quality data. So Mustafa and I, we talked about this earlier. You've done a wonderful job installing streetlights in different parts of Nema. I think in parts of Brikama, it'll be helpful to really attach them. They're very easy to attach to poles. We'll just attach the sensors to one of those poles. And then now you have solar streetlights with ongoing real-time hyperlocal air quality sensing. And that kind of puts Brikama on a path towards becoming a smart city. And some of this stuff is theoretical, but we're in the era of quantum computing. And the kind of things that we can do with the data we're going to get from this is very powerful. But I agree with you that together we can work around maybe partnering with the health center and the hospital in Brikama to see about connecting that information and maybe think about getting some public health messaging to the different kafol and local radio station. We can have health talks and raise awareness at the community level about the importance of air quality. So there's an opportunity there to collaborate, and I think that like I said, it would not come at any cost to you guys in Brikama.
Absolutely. I think one of our strategic priorities for the urban revitalization program for Brikama Nema, it's to bring in professionals like yourself and including people with different expertise to educate our communities about various things. It could be engineering, health, education, and stuff like that. So it's more like an exchange of ideas and knowledge to better our community. So I think this is a great initiative for us. We already have a strategic priority identified on this, so this would be great. And it's one of the reasons why we are working very hard to kind of get like a recreation center to host events like this. So right now, this event, you are having to host it at the Caraba Conference Center, which is definitely expensive. And it's a ways out there, but having something at a community level, Brikama, I think that's even better. Anyway, this program is gonna end any minute, so please use the same link to go one last round. I want to make sure everybody has a chance to talk. If they have any questions, they can ask you the questions before we wrap up today's discussion.
Okay.
So yeah, if you get cut off at any moment, just click on the same link and you should be able to come right back on. So for those of you joining, this is Dr. Ture. He was going over the Permian Health Institute's air pollution. I don't know, is it a tool, technology, whatever?
Network, air quality network.